So I did my presentation on breast cancer because I've had many experiences with breast cancer with friends and family, so I thought it would be a good pathogen to look into. Um, with breast cancer, they haven't had a specific cause yet. They just know things that can be related to it or what can cause it, and it can be gene related. So if somebody in your family or um, your genes just catch it, that can be how you can get cancer. And it can just develop in your hormones. I know that with my aunt, she got diagnosed with breast cancer and they had taken it out. And she went back a year later and she was diagnosed with 4 different cancers. And these cancers had never ran in the family. So it was her hormones that developed this. And it can also be the environment that you live in. Um, what is affected? Um, as we all know that there are many different types of cancers. With doing my project on breast cancer, it mainly affects the ducts and the glandular tissue, which are the 2 main tissues in the breast, which help with developing. The main organ system that it affects is the endocrine system. The system helps the breasts develop. So when it's interfered and it's not growing at the pace that it needs to be, the breast can contain cancer cells, which develops the cancers in the breast. There are multiple signs and symptoms. I know the main one that they tell us to look for in women are finding lumps that are about pea size. And after looking into it, a lot of it is looking to make sure and see how your breasts are changing as well. If you see any discharge or swelling or any inverted breasts, this can be some symptoms. The final sign and symptom usually is when you see the discharge. It will either be clear or a bloody discharge. Discharge can happen when you're pregnant, so if you are pregnant, don't be alarmed. It could just be because of the way that your breasts are developing while having a baby. There are many different treatments that we can do. I know that a lot of people, when they get diagnosed, don't think about treatment. I know that my aunt didn't want to go through treatment until my grandma told her that it's probably the smarter idea. There's local treatment, is when you go through surgery and radiation, which removes your whole breast. It helps the doctors do this so that they can remove the whole breast so that it helps to not develop more cancer in the breast. There's systematic treatments, which are usually medications. It is through mouth or blood and it targets at the cancer cells. Systematic also involves chemotherapy. And then there's biological therapy, which is using your own immune system to fight cancer cells. And it targets the cells containing high levels or certain proteins. Preventions that we can all take is drinking less alcohol, making sure that you're at a healthy weight, eating healthy, just making sure you're eating a healthy diet will always help, and trying to limit ourselves as much as we can to pesticides and antibiotics. Short-term consequences are things that happen um, right after 6 months after. Um, I know short-term consequences involve depression, especially with patients that had to have their breasts removed. I know that some women have breasts that and it gives them confidence. So when they lose that, um, this can cause them to go into depression. Um, Menopause can evolve. Even if you're younger, you can have symptoms of menopause. And then osteoporosis can be affected because of the drugs that they give you and the pain either from a tumor, surgery, or radiation. So as you're recovering from surgery, you can have a lot of pain still. And then long-term consequences is also menopausal as well. As I said in the first one, can be temporary or permanent after the 6 months. Patients can be affected by their hair growth. It could grow back a different color. It can grow back a different texture. It can be more sensitive. It can be thinner, and if the patient had thick hair before, it can be very disappointing for them. The patient can still suffer from pain. If there's a scar, it can still be super sensitive. The patient can still become very tired, and they can suffer from lymphedema, which is just swelling of random parts of the body. And they can also become infertile. And then those are my references. And breast cancer was super interesting to look into. I know that we all hear about it all the time, but once you look more into the detail, I think that we learn more about it, and it makes me want to make sure that I'm living as healthy as possible. So thank you for listening.